Pyogenic abscess is a abscess that is created by bacteria. And so this is going to be a little bit more common than some of the other abscess that we have talked about. So let's take a look at how these patients are going to progress and how we can treat these patients. So pyogenic abscesses form as a pocket of pus within the liver, and these are always going to be due to bacterial infections. There are lots of reasons that pyogenic abscesses can form. So basically there needs to be some sort of infection within the body, and then the bacteria from that infection travel into the liver to create the pyogenic abscess. We'll typically see the infection starting from somewhere near the liver, so like the gallbladder or the common bile ducts, or it'll be from the colon, and then the bacteria travel through the portal venous system up into the liver. So infection of the biliary tree is the most common reason for somebody to develop a pyogenic abscess. So we can have cholecystitis, that's gallbladder inflammation, or cholangitis, which is bile duct inflammation. Other GI tract infections, diverticulitis and appendicitis, can both cause bacteria to travel up to the liver. And we also see it with osteomyelitis, and bacterial endocarditis can also cause bacteria that end up in the liver to form these abscesses. Clinically, these patients are going to have your classical infection signs. They're also going to present with some abdomen pain, nausea and vomiting, and pleuritis. Once a patient is diagnosed with a pyogenic abscess, as long as it's treated, they typically have a good outcome. If the treatment is delayed or maybe ineffective, then the patient can develop sepsis, and sepsis is pretty hard to treat. So the outcomes become less positive once the patient has developed sepsis, or we'll see those abscesses start to develop in other areas like in the brain or in the kidneys, other parts in the body. So sepsis is a blood infection, and it is the #1 killer in hospitals. So again, once a patient has gotten septic, it is very difficult to get them back to a healthy state. Treatment then for pyogenic abscess is going to be antibiotics is the first bit of it, and it's not just going to be send you home with a Z-Pack and hope everything's okay. It's going to most likely be a hospital admission, and it's going to be IV antibiotics that are very, very strong. They might also put a drain within the abscess. That is something that we help out with in ultrasound. That drain is placed, and that kind of just gets all that pus and yuck out of there, and then they can make sure to irrigate it and really clean out the area that the abscess had developed in. And then surgery is also another option where they can go in and surgically remove the pocket of pus. So when you are in the ultrasound department and you are placing a drain for an abscess, what they typically like to use is a pigtail drain. And you can see by the picture here, it has a nice little curly end on it. So kind of like paracentesis, the doctor will identify the abscess by ultrasound and find a good window to access it. And then they will place a needle in, and then that needle will guide in the pigtail drain. And then that little curly end kind of hooks inside the body so it can't fall out. And then this pigtail drain then will allow all that gross pus stuff to come out, and those usually stay in for a week or two while the abscess drains. So assessing for abscesses anywhere in the body is pretty common ultrasound order. Let's make sure that we know what they look like when we see them. So the pyogenic abscess can vary in appearance based on its contents and progression. Typically, the abscess will appear as a heterogeneous mass with irregular walls, usually in the right lobe of the liver. Because the abscesses are formed based on bacteria, those bacteria can produce gas, and what ends up happening is that gas will rise to the top of the abscess, and it'll appear as bright white lines that cause comet tail artifact and dirty shadowing behind it. The debris in the abscess can also settle, and this is going to cause a fluid level where you can see there is a clear distinction between the different types of material within the abscess. If we were to roll this patient, the appearance of the internal contents would settle into a different area based on gravity-dependent portion of the anatomy. So pyogenic abscess are going to be more common than amoebic abscess, mostly because they have more indications or more reasons that those pyogenic abscess may form. It's important to know the difference between the two abscesses, pyogenic and amoeba. The main one is that pyogenic abscesses have irregular walls and are heterogeneous, where amoebic abscesses are going to be more round and smooth-walled.